As the discussions go on from here and as the Medicare package is developed, I want to stress the importance of a few issues that are of key concern to the Congressional Black Caucus Health Brain Trust and which relate to the healthcare services for the tens of thousands of Americans with chronic kidney disease and end-stage renal disease. Of course, the Kidney Care Quality and Education Act is among those priorities that we all support and find is critical to the issue that we're talking about today. But first, and included there, we need greater emphasis on prevention across the board. We need to increase funding for prevention initiatives under Medicare to ensure that our nation's most vulnerable have the information and preventive care that they need to live longer, better lives. Second, we need to ensure that if we change to a bundling payment system, which we generally oppose, but if we're going in that direction, that we know going in on the front end that it will not adversely or detrimentally affect the health and health care of people with end-stage renal disease. And so we feel that this will require demonstration projects. This is especially important to us in the CBC because African Americans and other people of color are disproportionately affected by end-stage renal disease, and studies have shown that African Americans and other populations groups sometimes require higher doses of EPO in order to manage their conditions and improve their health outcomes. Finally, we need to ensure that patients and their families have the option to choose to remain in their health plans because preserving choice as it relates to health and health care is critically important. And as a physician who came out of a solo practice to come here, that is really paramount for me, that we retain choice. And that means extending the MSP period for at least 42 months. This provision was in the CHAMP bill that passed the House, and it should be included in the forthcoming Medicare package. And we're going to work to see that it is because it's good policy and it simply makes good sense. And with that policy would come savings that could go back into prevention. So we would be addressing two very important issues.